Thank you for joining us this live with Miami's Community News. And our guest today is Dr. Gina.
Rina.
Rina Santiago-Guia. Okay. Thank you for being here.
Good morning.
Good morning to you. And we have our studio audience over there, behind the scene over there. So, Doc, so you're a clinical psychologist.
Yes.
You went to Nova Southeastern, got your doctorate there.
Mm-hmm.
And tell us what you did for your internship and where you've been working before you co-founded your healthcare facility.
Well, I received my doctorate at Nova Southeastern University. My internship was at the VA in San Juan, Puerto Rico. The internship was 1 year. After getting my doctorate, I did a 2-year residency at Nebraska Mental Health Center. My direct supervisor was Dr. Matthew Nassetti. I was out there for 2 years in Lincoln, Nebraska. And then I started working primarily with infant mental health, focusing on children under the ages of 5, so 0 to 5, and spreading the word of early intervention and its importance. I became a certified child developmental intervention specialist during that time. And 5 years ago, we started Monarch All Health.
So out of all the fields you could have gone into that life has to offer,
Mm-hmm.
why did you choose this field?
You know, it's interesting. I went through a couple of other fields. I always wanted to work with children. I knew that. So I actually started pre-med, and I wanted to be a pediatrician. I volunteered at an emergency room after 3 years of studying pre-med and realized I don't do so good with blood. I get very lightheaded, practically pass out, and I said, that's not good. So another love I have is for animals. So I thought I'd try pre-vet. So I did that for a year. Same issue, volunteered at a shelter. Animals would come in bleeding, and I couldn't handle that. I was mostly just playing with them. So I was like, this isn't going to work for me either. I took one class in psychology in my undergrad, and I realized, wow, I really like this. And I did my undergrad at Barry University, and it just came so naturally to me. I loved everything about the class.
So already, when you tell your story, it's one of trying things and looking to it. Say, is this going to work? All right. And that's not going to work. Let's try something else. So people shouldn't be afraid of trying things. All right.
Absolutely.
Right.
Absolutely. I mean, it's all about figuring out what it is that you like. And what I always recommend, because I do help a lot of doctoral students or even undergraduate students studying psychology, they'll ask me questions. They'll call me for interviews just to kind of get an idea. There's so much out there in the field of psychology. And I remember when I was trying to figure it out, I was like, oh my God, who do I ask? So I'm very happy to always help the community and upcoming generations and answer their questions. And I always say, you know what? Go out there and volunteer somewhere. Actually get the exposure. That's how I figured out what was best for me.
So when you just said, who do I ask? So here you're working with very young children.
Mm-hmm.
And at that young age, do you think some of them are saying, who do I tell and who do I ask? Who can I get close to?
Well, absolutely. Absolutely. I mean, my focus was 0 to 5, although I do work as a licensed psychologist. Right. I work with all age groups. But definitely, of course, first stop and think, what is it that I like? What is it that I enjoy? Talk to parents, talk to family members. As you get older, I've actually just said, go online, go look around, look in your community, see what's available. You like psychology? Just call them. Not all of them will hang up on you.
So 5 years ago, you started Monarch All Health.
Yes.
Why?
I had my little girl. I got pregnant and I decided to have my little girl. And I actually thought, okay, I'm an older mom. I've spent over 10 years building my career. I'm okay with putting it on hold for a little bit so that I can be a full-time mom. That was my plan. And then my partner, her father, came up with this great opportunity, and he found an office in a great location in Homestead. And he thought, why don't we start a business together? And I thought, it's a business. I just had a baby. Like, what are you talking about? And he was like, why not? And I went and I saw the office, and I'm like, well, here's the deal. I need to be able to stay with my little girl. Shailene needs to stay with us. So she had her own room there. And I said, well, if we're going to do this, I want to do something that I feel has been lacking. In the 10 years that I was working, one of the things that I noticed was when families would come in for services, they would need several services. It wasn't just therapy. I would evaluate them. That was my job, my previous work. I would evaluate the children, and they'd need speech therapy. They'd need ABA therapy. The parents would need individual therapy. The siblings would need developmental
Sounds
testing.
like my family.
I mean, they would need so many services, and yet I would have to ship them, to other places to get these services. And I said, I would like to start a place where we can get as many services as possible in one place, all together.
So what do you do to try to help people believe in their soul that it's okay what you're feeling, right? And then you're taking it from the shadows and bringing it out front. How do you help people get to that point to where they're open enough to say, hey, here's what's going on?
Well, I mean, every person is different and every age group is different, so it depends if we're talking about adolescents or if we're talking about adults. But at the end of the day, regardless of the age that you're working with, it's all about allowing the patient to feel comfortable with you. You want them to feel that they're in a safe space. And sometimes they're not ready to express, they're not ready to go there. And that's okay. That's okay. When you're ready to explore, when you're ready to move forward, then come back. And we're here.
So at Monarch, you provide a wide range of help. You have male and female therapists, right? And so what are some of the services that you provide?
Oh, well, I'm very happy to say we have a very wide range right now. So we do psychotherapy, which even within that, we do have certain specialties. For example, EMDR, eye movement desensitization and reprocessing. We have cognitive behavioral specialist. We have psychodynamic therapists, various different modalities that they each specialize in, which I think is another thing that really sets us apart. As a psychologist and as a therapist, you can work in many different to use different theories, but to be able to just kind of specialize and hone in on one area, we have different providers who each specialize in their own area and work with their own age groups. And then we decide, okay, so this person is coming in for this. They speak Spanish. This is their age. They're looking for something that'll help with trauma. They go to that person. We also provide medication management. We have an amazing psychiatric mental health nurse practitioner. We have speech therapy for adults and for children. We have ABA therapy. We have, so I do the psychodiagnostic testing. I think that's everything.
So in speech therapy, so somebody could go to you, say, here's my daughter and my son, they're having some issues. And then you try to work with them, try to improve their ability to communicate.
Yes, well, speech therapy is also geared towards children that have difficulty eating. Sometimes it's working with the muscles of the mouth. It's sometimes even adults who have trouble, eating the right way. It helps with that. Speech therapy goes a little bit more in depth. Our website gives a great explanation of all the services that we have.
Child. Right,
our boss, big girl.
Boss big girl.
Yes,
that's
my
at
daughter.
monarchallhealth.com.
Yes.
So people can go there, and you have some of your therapists.
All of our therapists are there. Yes.
So right now I don't know where we are with COVID. I know we're not at the beginning, but we're not at the end. Mm-hmm. But this is the first time I think that everybody, the schools are back in session and with hope. But it's been pretty traumatic for most people.
Yes.
So tell us about how you, when people come to you, how you deal with this isolation that has occurred and they're not being with their friends.
That is a big one. So the cases that I get, again, I do supervise all of my non-independently licensed providers, but then myself, what I do there in addition to running the business is I do the psychometric testing. So a lot of parents I'm getting are coming in and they're just they don't know if the difficulties or challenges in the behaviors that they're finding their children are having, and this is both for little kids and for adolescents. Mm-hmm. Does it have to do with the pandemic? Does it have to do with that period in which they were isolated, that they were not exposed properly? Is that why now we are seeing these behaviors? Is it something that maybe was always there, but now we don't see? So these are things that are very valid questions to have and things that need to be, in my opinion, psychometrically tested. Clinical opinion is important. It is valued. It is valuable. However, in addition to that, having raw data to support what it exactly is that we're looking at, I find it to be crucial, especially during this transitionary period.
So my granddaughter is 5. So half her life, she's been surrounded with COVID.
Mm-hmm.
It's amazing. All right.
Mm-hmm.
For us, it's been a couple of years, and it's been traumatic for lots of people, including for a lot of small businesses, which is yes, no, you're going to get it now. What are you doing? You have people separated. In our operation here, I am thankful now when people stop for a moment and socialize. A couple of years ago, get back to work, get back to work. Now it's like, thank goodness they have
Yes.
somebody to talk to, right?
Mm-hmm.
And we see that, so we're very thankful to that. We understand that there's a new phone number for people that are not feeling too well. Suicide. It's not. I don't know if it's a suicide prevention line, but it's 988. I think that's the number, national recognized number.
Okay.
Right. But if somebody right now is having some really big emotional issues, what do you want them to do? They're watching this and they say, "Listen, I'm not feeling good at all. What should they do?"
Well, reach out and get the help, without a doubt, and don't be afraid to ask for help. That's the biggie. There's a stigma, unfortunately, that still remains out there with regard to the need for mental help. Sometimes it's just a matter of talking to someone. You'd be surprised. Oh, what's talk going to do? Listen, talking lets your feelings out. It gets it out of your head. You get yourself out of your head. And when you get out of your head and you're able to bounce these thoughts off, suddenly it's like relieving a balloon. It's like all the pressure just comes off. So don't stay in that dark place. There is a huge white light out there that you can go to. And there are people there to help, whether it's at Monarch, whether it's anywhere. If the good with Monarch, you can go to our website, check out the providers, see who you feel comfortable with. Some of them have videos, look at their pictures, do it online. Don't even have to talk to us yet. Go ahead and do it online. Make that first step.
So for parents that have been struggling during COVID, and their children certainly feel that, all right? What is it when a parent recognizes, I'm looking at my son, my daughter, or grandchildren, and I can see they're behaving differently today. So the parent should take a look, call somebody, whether it's you or somebody else, and say, here's what I'm seeing in my dynamics. How often does a parent come in with the child? Is that usually separate? Does the child wind up having therapy separate, or do they typically do that together?
That is actually a very excellent question. So a lot of families who work with who come in, they don't know how therapy works. They've never been in therapy. They're wondering, how is this going to work? So one of the first things that I always do is I educate them on if therapy, play therapy, family therapy, individual therapy is the recommendation. I let them know, you guys are going to be a very big part of this. It's not an issue where you just come, drop off your child and come back. No, children work within a family system. There's a dynamic, and we have to work with that entire system. So there will be times where the child will be with you just kind of one-on-one, so that we can build that relationship, we can build that rapport with the child so they feel comfortable. But then there will be times where we're going to have to speak with the parent. And this can go from ages, 3 all the way up through adolescence. There will be a communication with the parent, because we have to let you know, okay, so here's what we're working on. Here are the coping skills that we're working on. Now, for those adolescents, it's important that the parents also understand there is a certain level of confidentiality. So we can't just tell you everything that's happening in the therapy session. And there is a level of trust that needs to happen there. And the patient understands, the adolescent understands there is a limit to this confidentiality. But the parent is still very much a part of the entire therapeutic process.
So what is it like for you and then for the family when you do some testing and the parent was wondering what was going on with the child, and then you give them the diagnosis and the prognosis? What is it like for you when you have to deliver some not so good news?
It's not pleasant. It's not pleasant. Sometimes there are certain diagnoses that are a bit more difficult to give the news about. But what I like to focus with the parents is, okay, this is where we are right now. Okay. The important things is that now we know what we have. Now we know what we're dealing with. Let's accept what we're feeling, and then let's see, where do we go from here? And I feel that with them. And I feel whether it's the concern for their child's future, the disappointment, and they were hoping it was something else. And I kind of stop and say, okay, let's talk about this for a minute. I don't just deliver results and say, okay, here you go, bye, next. No, let's talk about this, because whatever they're feeling is what they're going to go home with, and that's what the child's going to feel. So it's important that they understand, let's talk about what this diagnosis means. Let's talk about it, what it means for your child, and let's talk about how we can move forward.
And that's an important issue, because at some point things happen in life, all right?
Mm-hmm.
And so the stability of the family unit, all right, is really important, so the child can be the best that they can be.
Absolutely.
And
Absolutely.
a friend of ours runs a friendship circle at East 7th Avenue, 112th Street, at the bottom of Kendall and Pinecrest. And I've become acutely more aware of the issues that are facing families and children as I watch more and more of this coming out from the shadows and being presented to us. So sometimes I think that I'm just imagining it's moving forward, but is it coming out into the open a little bit more than 10 or 15 or 20 years ago?
Well, it's hard for me to say. I've been in, well, I guess I have been in it for now 15 years. I forgot. Sometimes I forget how long I've been doing this. I mean, I do think that as we grow, as the time goes on, more research comes out, more people become aware, more people are more open to understanding that the importance of getting help, the importance of realizing that there should not be a stigma associated with mental health, and also understanding that therapy isn't what it was, that before. This going to therapy now doesn't mean that you're going to be in therapy for the rest of your life. I mean, it might, and that's okay too. But sometimes that's what will derail some adults or some parents say, I don't want to do this for the rest of my life. Yeah, then you start, and then you don't want to go because it feels so good. Another thing I like to also emphasize is therapy isn't only for somebody who feels the weight of the world on them. Something is just somebody who's confused. Somebody doesn't know what they want to do with their life, and they need somebody to bounce ideas off of, someone to kind of get a little bit of a grip of a hold of what's happening in their life. And they're in session, and they're in there. It's, probably do more solution focused work for a couple of months, and then they just fly.
So and so often people need to feel as though they need permission to be able to change careers, or to say, I don't want this anymore. Years ago, and when you leave, look on the front of the building on the side.
Mm-hmm.
And it was, my father was asking me, what do you want to do? This many years ago. I said, I don't know what I want to do for the rest of my life. And he said something interesting, which now is emblazed in bronze. Well, why don't you do whatever you want to do until you don't want to do it anymore? But do the best you can. And then when that part is over, then go do something else. And so often we need somebody to say, it's okay.
Yes.
Right? And I had an experience. I wasn't feeling good years ago. I go to my doc, and he puts his hand on my shoulder. He said, what's going on? I see you, and I already feel better. I said, I just needed somebody to listen, just for a moment. He said, well, since you're here, let's do these tests. All right. Don't drink so much caffeine, Michael, and get more sleep. All right. And sometimes that's all it takes. And it's okay if people want to be in therapy for a year or 5 years or 10 or whatever it happens to be. Let's talk about people that can't, who think they can't afford financially to get into therapy for themselves or for their children, right? What can we do as a community to help those people?
Well, a lot of people who I found that can't afford it, for the most part, Medicaid is something that they do qualify for, but they're just not aware of it, or they don't know how to do it. So definitely setting up, getting them together with a case manager, which is another service that we also have. Case managers can help them to, let's find out exactly what you do or do not qualify for. So at Monarch, even in those cases, we've actually put together packages. So it comes out cheaper to get certain amount of sessions at once if you just pay it up front, rather than just paying per session.
So people that are in need now, and sometimes they're not quite sure how much they need it, but once you get in it, you realize, hey, I really need this.
Mm-hmm.
They should feel free to call you or to email you, so they can at least find out what's going on, right? And figure out if they can do something.
Yes.
But for sure, people, if they've picked up the phone to call you, they recognize something within themselves or their family unit.
Absolutely.
So it's important for them to have some sort of pathway to having some better health, about them. So let's talk again, teenagers. That's I don't know any teenagers that are really driven, all right, that haven't wondered about themselves. So sometimes kids will say they're confused about things. How do you get a young person to open up?
Teenagers. Well, first of all, that definitely is a challenging population to work with. Unfortunately, sometimes they come in just because their parents made them. So the most important thing in working with teenagers is building that relationship with them. So especially the ones that are coming in, oh, I'm just here because my mom wants me here, but I really don't want to be here. I like to do art therapy. All right, that's cool. Let's just draw. Do you know how to make a bracelet? Let's make a bracelet. And you just kind of get them to feel comfortable. Well, why do your parents want you to come here? What's up with them? What's going on there? So you try to speak their style. You try to talk, in a way while still at the same time. So to them, it'll feel more like, oh, we're just talking and having fun. Good. But I'm also trying to figure out, I'm trying to put my mind in your world and see what is it that everyone else is seeing and how can I help you to see that? And then we decide what you want to do with that. It's a balance between what the parents want and what the child wants. And then sometimes it ends up being bringing the parents in and saying, okay, here's what's going on. Here's what's happening with your child. How can we work together?
Years ago, my daughter and son, many years ago, were going to a teacher, a tutor, and tutor calls me. Toby Rose, thank you. And she said, I got to talk to you. I said, okay. I go down. So they confided in her a problem that was at the house. And I took care of it that day. Right. But they couldn't tell me, but they had to tell another person. So they got done what they wanted to get done, which was and it made me and them feel really good. But on the other hand, I'm going, why didn't I see it? Why didn't they tell me? All right. So there was this and how long is this going on? How much damage occurred because of that? Well, what I was thankful for is that they had the courage to be able to tell a third party like yourself. Mm-hmm. And then you'd say, I know she said, do you want me to tell your parents? Yes, that's why I'm telling you. All right. And it was perfect. All right. So there is a great need for that. We know that, especially, most of the time. All right. Whether, you're 5 years old or 50, sometimes we need somebody to be able to listen. And I think the example that I've heard so often is that teapot with the steam going off. And if you close it up, it's going to explode rather than letting some of that steam.
Absolutely.
So if somebody's feeling a little anxious, child, and a little depressed, what should a parent be looking for? Does look at their young person and say, I think there's a problem here?
Well, again, it depends on the age. So with the little ones, and when I mean little ones, I'm talking, under the age of 5 and maybe even under the age of 7. Depression in children is not the same as depression in adults. So a child who all of a sudden is easily frustrated, they're crying at the dime of a hat. It's like, whoa, what the heck happened? But it's a change. There's a difference. They're easily frustrated. Think they just kind of blow up out of nowhere. And you're like, okay, this is not my child. That is a sign. That is a significant sign. And if that maintains for at least 2 weeks, you definitely want to get some help. You want to have a professional intervene. And when they're young, which is why I love working with the little ones, it really is just little tweaks, little things, little changes in the environment. And when I mean environment, I mean in the home, that will help that child to feel stabilized again. And those symptoms can therefore go away. When you're working with the adolescents, and what overall changes. Suddenly they're sleeping in more. They're not as much, or they want to go out all the time. If it's a change that maintains for at least 2 weeks, that is significant and should be addressed.
So it's important for parents and spouses to be able to look at each other and figure out what's going on. Years ago, I used to run marathons, and we'd always check in with each other. How you doing? How you doing? Okay. One day he said, how you doing? I said, not good. First time in 25 years. He goes, really? I go, really? So I'm holding on to a fence. I see a fire truck, and I go, wonder what's going on. I'm rehearsing. And he sat down with me for 30 minutes, and I got better. And then I finished. But during that moment when he sat with me, that was probably 10 years ago, it still stuck with me that somebody was there that was really listening. Because so often we say, how you doing? Great. Okay. And then you move along your way. So it's important for parents and spouses and siblings to listen to each other and to
Absolutely.
figure out, and they have a problem, they call you, they can call 911 if there's an emergency. Right?
Absolutely.
And we're so glad that you're here. And we have just a few seconds left here, but what I would like you to do is talk to this camera and talk about young people out there and about how they can look at their future here in Miami-Dade County.
Well, one thing I just want to let everybody know is that the future here is very bright. The future here is beautiful. And no matter what it is you may be feeling or what it is you may be going through, there is always, always sunshine and light out there. And if you're not seeing that, then there is always somebody here to help you.
Wow. Doctor, thank you so much for being
You're
here.
very
Appreciate
welcome.
your
Thank you
time.
for having me.
Folks, again, thanks for joining us live at Miami's Community News. Have a great day.